Hello and welcome. I'm Dr. Ankit Gupta, plastic surgeon, and today we'll be discussing a case of xanthelasma. Xanthelasma, or the yellow deposits that you see around your eyes. These are nothing but the cholesterol that gets deposited around your eyes, and it is seen in patients who have either high level of cholesterol or it can be because of absolutely nothing, that is idiopathic. What I'll be explaining today is a surgical procedure through which I prefer to remove the xanthelasma completely. Xanthelasma is not just in the skin, but it is usually up to your muscles, which are the muscles of your eye. So it is not exactly the eye opening muscles, they are the eye closing or the orbicularis muscle. We mark the area where we need to remove and then we inject a local anesthetic solution. It is injected through a very fine needle, which is the insulin needle, and it really feels like a very slight pinch or a prick, and this will not only give anesthesia to that area but also will reduce any kind of bleeding. Then the next step is to remove the xanthelasma. We give a cut all around the xanthelasma and try to completely remove all the fat that has been deposited inside. All the fat is removed right up to the muscle level. If required, we can even remove a little bit of the muscle, and don't worry, it will not cause any harm to your eye, eyeball, eyelid or anything at all. And this is the process through which we'll be removing all the xanthelasma that is present. The other ways of removing xanthelasma is either through chemical cauterization or through lasers. The problem with chemical cauterization or lasers is that it will burn the skin either through a laser or through chemical cauterization, and that will cause scarring. Whereas when we surgically operate, when we surgically cut or remove the xanthelasma, it does not cause any scarring. What it does is it removes completely, and when we stitch it together, it leaves a very fine line. And the best part is that the skin over the eyelids are so thin that the scar is hardly visible. Once we have cut it, we coagulate the blood vessels so that there is absolutely no bleeding. All the bleeding is stopped, and then we see to it that all the fat is completely removed. Nothing is left behind. The other problem with chemical cauterization is that the recurrence rate is very high. Although even with surgery, the xanthelasma can reoccur, but with chemical cauterization or with laser, since we are only burning the superficial skin, it comes back really fast. But with surgery, the recurrence is either not there, or even if it comes back after a long duration. Once we have removed it, we just stitch it, and these are very fine stitches, thinner than your hairs, so that there is absolutely no scarring. The only what remains is a very fine line, and under magnification we operate the patients so as to give you a very fine line, and we close it, and the whole process takes hardly 15 to 20 minutes for each xanthelasma, and it is done under local anesthesia. The recovery is really fast. The stitches that we use are the non-dissolving stitches or the dissolving stitches, depending on where you stay. If you stay nearby and you can come back for stitch removal, we prefer to use the non-dissolving stitches, but if you stay far off, we prefer to use the dissolving stitches, which shed off on their own. And this is how you look after your stitch removal. See, even with your eyes closed, it's very difficult to find out where the xanthelasma was, and this is how you look after the surgery, and this is the before after. Thank you, and if you wish to know more about it, you can always contact us, or if you have any more queries, just write us in the comment box and I'll try to answer all that as soon as possible. Thank you and have a nice day.